Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then let us now learn the differences between the hepatocellular carcinoma and also fibrolamellar hepatocellular carcinoma. So, if we see the differences between hepatocellular carcinoma and fibrolamellar hepatocellular carcinoma male is to female ratio is almost equal to 2.1 is to 8. Sorry. The male and female ratio is almost equal to 2 is to 1 to 8 is to 1. Whereas in fibrolamellar carcinoma, males and females have almost similar incidence. Whereas if you see the median age in hepatocellular carcinoma, it is around 55 years, whereas in fibrolamellar carcinoma, median age is almost 25 years. So 25 years is more common, the young age is more commonly fibrolamellar carcinoma is more commonly seen in younger age. Then if you see tumor is highly invasive in hepatocellular carcinoma, whereas tumor is well circumscribed in fibrolamellar carcinoma. If you see resectability, almost only 25% of tumors are resectable, thus it has poorer prognosis, whereas in fibrolamellar hepatocellular carcinoma, almost 50 to 75% tumors are resectable, so it has better prognosis than hepatocellular carcinoma. Cirrhosis is seen in 90% of cases, whereas cirrhosis is seen only in 5% of cases in fibrolamellar hepatocellular carcinoma. Raised alpha fetoprotein levels are seen in almost 80% of cases with hepatocellular carcinoma, whereas these are seen only in 5% of cases of hepatocellular carcinoma. Hepatitis B virus is positive in almost 65% of hepatocellular carcinoma, whereas hepatitis B virus is positive in 5% of fibrolamellar hepatocellular carcinoma.
Thank you and thank you for watching.